This panel is structured a little bit differently than most. We are going to watch an interview first that I did with Mayor Jackson this morning, and then to expand on the points that he makes, we'll be back with Valarie and Robert in just a minute. I'm very pleased right now to be joined by Mayor Frank Jackson of Cleveland, the longest serving mayor in the history of that city. Mr. Mayor, welcome to the Health and Wealth of America.
Well, thanks for having me.
Let's start by talking about, just describe for the audience how the vaccine rollout has been going in Cleveland. What have the biggest challenges been, and what have the most effective strategies been?
Well, the biggest challenge we had was is that we didn't have an infrastructure. It's a pandemic, and that we did not have an infrastructure for, in terms of the volume and the depth of it, and not only in terms of on the health side, but also in terms of the impact it had on our hospitality industry. It came quickly, and it was severe, and it was deep and long lasting. So the combination of those two, we had to quickly put together strategies on how to address the economic impact, the people impact, and then also the impact of the pandemic at first in terms of testing, identifying, setting up policies around prevention and getting enforcement in that regards. And then when the vaccine began to roll out, then we had to create an infrastructure to receive the vaccine and then dispense the vaccine.
And what has that experience been like? What were the challenges you faced in trying to create that infrastructure and getting actual, needles into arms kind of on the ground?
Well, we were giving, for the lack of a better term, mandates as to categories of people, who was first, prioritization, and then say, well, here you have these number of vaccines, now you get them out. And that was the challenge of how do you get it out? And so we had to set up what we call pods that were the places where people came to and dispense it. And then we had to follow the state mandate on priorities, and how do we communicate to people, and how do we give people understanding that their turn would come, as the demand was far greater than supply. The national effort in terms of that national infrastructure has worked pretty well since the change of administration, and that has meant that we've had then supplies coming in, but we didn't have capacity to dispense it. So we had to build this, the pods, had to get people who, and the systems in place as to how that would happen. How do you handle people coming? How do you set up appointments? How do you communicate to people that they're eligible, get their appointment, and then monitor that and manage that when they come to sites? How do we deal with the equity side as to who gets which shots, and how, where is it convenient for people? Now that's just on the city side, the city health department. And when you look at the pharmacies and the hospitals, they too had to develop that on their own. And then the final thing is, how do we communicate with each other and collaborate and create some kind of flow between the various dispensers of the vaccine, so we can have a pretty good indication as to how things are going.
Yeah. Do you feel that Cleveland had the help that it needed? I mean, what was that like, having to coordinate with the federal government and the state government and the private sector?
Well, the state government, federal government last year was not a big help, as you put all the responsibility on state and local government in developing infrastructure, doing all of what I described and more. And that's just on the pandemic, not talking about the economic and social kind of issues that were created. Our governor, Governor DeWine, in the beginning was very good in terms of laying out what the expectations would be, the preventive measures, the mandates, the restrictions of mass gatherings, mask and all that. And as time went on and the pressure built up, as you know, particularly among the rural areas and conservative areas of the state, um, he had more challenges to deal with. But he handled it, and we as Democratic mayors in the state worked very well with him and to carry through some of the things that we didn't all agree on all the time. But at least he provided leadership, and that was very helpful because we didn't feel like we were on our own.
What do you feel are the greatest lessons that you take away, both from the pandemic experience and the vaccine rollout experience? How are those experiences going to guide the way you govern in the future?
Well, you always have to be prepared, and you never know what you're going to be prepared for all the time, but you have to be prepared, and which means that my philosophy is, if you panic, you lose, and in a crisis, that's what people do. They panic, and what we were able to do was to, even though we did not have the infrastructure in place, there was no real historical kind of approach to this in recent decades. We were developing on the fly, and there were political things going on nationally that were kind of hindering things. The lesson learned is what we in Cleveland had always talked about, is that crises are going to occur. And when those crises occur, you cannot panic. You just have to settle down and deal with it, grapple with those issues, and begin to change the dynamics of those things. If you refuse to grapple with it, something's going to happen anyway. It just won't be what you want. But if you grapple with it, at least it will have a semblance of what you want. And in fact, like I said, Governor DeWine, even though we're Democrats and he's Republican, we worked very well together on a lot of the initial things that helped frame it in a way that it was very clear as to the direction we were going in. So that really helped. If it were not for his original leadership in that regard, it would have been much more difficult. Now, the final thing is on the economic side and social impact, meaning impact to people. We had to be very fluid in terms of our ability to address the impact on people in small and medium-sized businesses, because it's disproportionate impact of misery and suffering in a way that creates inequities. And a pandemic, not only on the health side, but on the economic side and in the human side, really pointed out and brought raw this glaring inequities, disparities, and how racism and classism fits into all of that, you see. And that became very challenging as people were trying to grapple with that notion as it became so obvious as to what was going on. And we were aware of it, and we had to then grapple with that without engaging in the conversation of it in a theoretical sense, making an academic debate about it. The academic debate is completely irrelevant. You can talk about that after it's over with. But right now we got to deal with it. And so I think those are the things that you have to take away. Crisis coming, don't panic in the crisis. And when the glaring, obvious things that we intuitively know or or know, but we kind of push to the side, becomes obvious, then don't get bogged down in pointing fingers or bogged down in having a philosophical debate about it. Just handle your business, and then when it's all over with, we can then discuss it. And then again, finally, it gives us an opportunity to make decisions for the future. You make decisions for good times and bad times, and you make decisions for bad times and good times.
Mm.
And it really positions us as we are looking to infuse an incentivized recovery of our hospitality industry, our service industry, our small, medium-sized businesses, the impact on people in terms of being laid off, food pantries, rent subsidy, all these kinds of things. It really helped us to have understanding as to how these things work. So we should not be caught again with our being unprepared.
Yeah. Well, it's certainly a conversation we intend to go into in great depth. So I really want to thank you for your time and your insights, Mr. Mayor. Have a great day.
Well, thank you very much.
So we'll move on to the live portion of this session with Valarie McCall, who's the Chief of Communications, Government and International Affairs with the City of Cleveland, and Dr. Robert Wyllie, the Chief of Medical Operations at the Cleveland Clinic. Welcome, both of you, to Health and Wealth of America. Dr. Wyllie, let me start with you. Can you capture for our audience what the pandemic and the vaccine looked like from the front lines from a healthcare point of view? What were the biggest shocks you saw, and how did you figure out how to overcome the biggest obstacles?
So starting back in December of 2019, which seems 5 years ago, I know it wasn't, but when we saw those pictures coming out of China on the evening news, it looked obvious that this was not going to be an event which was going to be localized to China or Asia. And with modern travel being what it was, and Wuhan being one of the largest cities in China, that this virus was going to spread, and that's what we saw. Looking at how the hospitals were overwhelmed, we quickly realized that we were going to have to get to scale, and get to scale rapidly. And as we learned more about the coronavirus and the infection, and we had modeling from the University of Pennsylvania and from the University of Washington, it looked like if nothing was done and we couldn't mitigate any of the spread of the virus, that we were going to need, the Cleveland Clinic system, for example, was going to need 8,500 beds. And although we have 12 hospitals, we have about 3,700 beds in Northeast Ohio. So the math didn't work out. So we, along with University, Metro, the other hospitals in the city, St. Vincent's, we all began to think about how we could expand beds. So that was the first thing, was get the bed capacity. And we tripled our beds, went up to 8,500. University and Metro also had significant increases in their bed capabilities. And we also looked at PPE and how do we start conserving PPE immediately. So immediately we looked at, well, what's going out of date? Does that really need to be sent back? Can that be re-sterilized or saved for a little bit longer? And we started holding on and ordering more PPE, as many others did in the United States as well. And then it was, how do we start to coordinate? So we met actually with the governor and the mayor's office, and we suggested that we go to 3 zones in Ohio, which turned out to be very effective. So there would be a zone coordinator, a medical person. I happen to be the zone coordinator for the top of the state. And we just divided it into 3 Cs. So Cincinnati, Columbus, and Mid-Ohio, and then Cleveland and Northern Ohio. And because we had the most bed capacity. And the other thing was how to coordinate then the hospitals and the local health departments, because we really hadn't done a lot of that. The city health departments, the county health departments, the hospitals, and then we have over 900 long-term care facilities in Ohio that house about 70 or 80,000 people with 80 to 90,000 employees. We didn't know how many were in each facility, so we got to work organizing the relationship between the local health departments, the local hospitals, and those people who were elderly, who looked like they were going to be the most at risk. And we started to put that system in place.
Valarie, the mayor referred to some disparities and inequalities uncovered by the whole pandemic experience. Can you talk about that in a little more detail and describe what, if anything, the city of Cleveland can do to address them?
Yes, thank you. And first and foremost, I just want to say it's a great pleasure to be here today with you at this forum, but also with one of my favorite doctors, Dr. Wyllie from the Cleveland Clinic. Um, I think what the pandemic has done, not just in Cleveland, but in communities around the United States, have shown that the things we know were there, those inherent disparities, whether it was broadband access, the access to transportation, or telehealth medicine. I know you were talking about that a little bit in the other panel, just did not exist. And it really forced us to operate quickly in a way that we hadn't before. So for example, Cleveland Municipal School District is, I believe, the largest school district still in the state of Ohio. Our children were at home. How do we make sure that they have the broadband connections and the hotspots and the things that they needed, even the computers, so that we can continue education? And so I think that those were some of the things that we saw from the beginning. The city of Cleveland utilized, under the mayor's leadership, some of our own funding to help support some of the businesses, but also our funding that we did get through some of the CARES Act to help with hotspots and making sure that we took care of those immediate on the ground things that we needed to take care of. Rent subsidies for residents. We talk about this, right? A lot of people are just a few paychecks or 1 or 2 paychecks away from being homeless or from poverty. And it was real because we saw it. And so utilizing those funds, and then utilizing a community. Dr. Wyllie knows this. The mayor always says in Cleveland, anything that we do and we're successful at, we do it as a community. And when we come together as a community, that's when we are our best. That's when we are our strongest. And so whether it was food pantries, I mean, we all saw it on TV. There were a lot of places where they had long lines. We had long lines too, but you know what? We never ran out of food to provide to people. And so just coming together as a community with the leadership, I think the mayor touched on the leadership from the state, as well as what we had to do locally. I think all of that helped, but it did shine a light, a very, very bright light on some of the things that we know we're going to have to change. But out of that, though, it also shown us some particular opportunities moving forward. With technology and some of the things you guys have been talking about today already.
Dr. Wyllie, the spread of the virus provided an opportunity to apply technology in some novel and truly innovative ways. Can you talk a little bit about how Cleveland Clinic harnessed technology?
Sure. So one of the things that we've done, which is novel for the state of Ohio, was we worked with university hospitals as well as Case Western University in the city of Cleveland. And we developed a platform of what we call Geospatial Analytics. And what that does is it takes test results like positive COVID results, and it localizes that result to an address, not to a zip code, but actually down to a physical address. And then we can collate all those results and we can look at outbreaks. So we started to define, well, what's a micro outbreak? And that's defined as 2 cases within about 50 meters. And then we went to larger outbreaks, but we could see them pop up immediately. And as soon as the test became positive, it went on our map. And we mapped out Cleveland and Cuyahoga County first. And then we would speak to the local health departments, including the county and the city. And we say, look, there's a problem in this facility. And we put Google maps on top of it. So we could actually point to a building saying, there's a building, there are 10 cases which just popped up in the last 7 days in that building. So testing needs to be done in that building. PPE needs to be provided. We need to make sure people are social distancing. We need to make sure that we can get them food, as Valarie said, if they can't get out and get food, because we want them to quarantine. All of these things had to be coordinated on the city and on the county level in order to make this work. Subsequently, we've gone statewide. So I just reviewed it again this morning. So we're looking at the entire state of Ohio, doing the geospatial analytics and highlighting the hotspots. And we meet with the health departments once a week to say, there's a problem in this county or that problem, and it's within this building and this actually address. And as we think about vaccines coming out, then you could think of, well, if you knew that there was an outbreak, would you go there and vaccinate everybody in that building to stop the outbreak and stop the spread? That's called ring vaccination. So that's something which we're just starting to consider.
It's the technology really sounds like something out of a movie. I mean, is it your contention that this application of sort of geolocating cases that stopped or slowed, I should say, the spread of the virus?
Yes, we're acting on it in real time. And we can also see, like when we first turned it on for the state, not surprisingly, I guess, we saw it around university campuses in terms of the positives starting to pop up. And we saw those pictures when the students were getting into spring break and they were tired of being cooped up and isolated, and they started to get together. And so that caused, we saw those. And then actually, Ohio State University, for instance, actually took aggressive enforcement and showing the students the data and then having them quarantine appropriately and do the things that they needed to do to bring the outbreak at OSU under control. We've done that with other universities as well.
We have a few minutes left, and if you have a question, please either raise your hand or type it into the chat. Valarie, what do you think are the big takeaways? What has changed permanently, either for good or bad, because of the pandemic and the vaccine rollout in Cleveland?
One, I think telemedicine, and I think that's for good. To be honest with you, if we talk about some of our harder to reach populations, most everybody have a cell phone. We don't, that was important. I think that the technology that Dr. Wyllie just talked about, we use their technology, we use their data to go out and set up vaccination pods and going on site to do vaccines and things. I think hybrid learning, it's taught us a lot of things about distance learning. I mean, at first we saw that only in the college area, but now guess what? It's in the K through 12, K through 8, kind of spectrum. And I think that's important. Even the way we do meetings now, some people joke about being Zooms within Zooms, but you know what? I've been more productive doing a couple of Zooms daily than sometimes the interaction you have, even though you miss that with people. But I think more importantly, this particular pandemic has taught us, whether it's 100 years from now or 30 years from now, we have to stay on top of the very things that we don't pay attention to. We have to make sure we keep funding technology. That's important. Yeah. Down to the equipment, and making sure we keep funding, research and development and the things that we talked about at the clinic. And I know Dr. Wyllie probably don't have time to go too much into this, but earlier I know in the panel before you were talking about AI technology and virtual reality technology, and Cleveland Clinic's medical school, that's how they teach their doctors. And that's one of the things that the mayor had said, hey, how do we take this same technology and now overlay this to our schools so that in the event we're ever in a situation like this again, we're teaching the kids the way that they learn. So I think there's a lot of good takeaways from this, but more importantly, even in the midst of controversy, it brought us together as a community, I think.
I definitely want to know more about the AI and VR education, but we'll do that at a future session. Let me close out with one quick question for both of you, really. Besides getting more people vaccinated, what's the most important thing that has to happen in Cleveland to put this pandemic behind us? Dr. Wyllie?
Well, I think people have to realize the pandemic's not over yet. The state which is exploding is just to our northern border. Michigan. Michigan has as many people hospitalized now as they did in the peak in December and January. That's starting to float into Toledo. It's starting to float into Cleveland. And so we have to mask, social distance, and everybody needs to get vaccinated. So we vaccinated approximately 50% of the eligible people, adults in the state. We need to get that up to 85% if we're really going to reduce the infection long term. So it's getting out to the individual people. It's understanding if they're hesitant, why they're hesitant, if they're resistant, why. And then it's bringing the vaccine to them in a convenient way and helping them to understand why it's important for them, as well as their family and their community.
Yeah, that's a really good point. Valarie, what are you?
I would echo what Dr. Wyllie said and just say, add that it's important that we give out factual information, that we're clear about what that information is, about what the vaccines will do and why it's important. And if I can just echo what he said, this pandemic is not over. If this thing has taught us anything, it's variant on top of variant on top of variant. I think that we all have learned more about ourselves, which vaccine we can take, because we have to be a student of our bodies and our history. And then we have to pay attention to what the science is saying. And if nothing else, it has taught us the importance of maintaining civic education and science education in our schools, because I think is very important. And so again, be factual. This is for real. This is lives. This is livelihood. And I think the biggest thing we're going to have to deal with, and this may be for another subject, obviously, is okay, now what, right? People keep saying we're almost
Right.
out. We're in the community. We're saying, wait, we're not nowhere.
Not quite.
Yet. We're not there yet. But at the same time, now how do we live and how do we maintain the people who will come out of this with long-term health effects? That has to be studied to figure out why they got that and how they got to this. So I just think that's very important. So I echo what Dr. Wyllie said.
Well, I'm sure with the cutting edge science at the Cleveland Clinic, they'll be able to stay on top of that. I want to thank both of you for joining us today. And of course, thank you to Mayor Jackson.
Thank you.